Dear audience, I'm Péter from the Heart and Vascular Centre, and my PhD thesis subject is the functional and morphological investigation of complex coronary pathologies, recent modalities. I would like to present you my 9 months progress report. My vision is to reduce the burden of coronary heart disease with improved coronary interventions, and my mission is to decreasing the need of recurrent revascularization and the rate of complications. I have 3 projects, from which the first one is already finished. Let me begin with that. This is the RAF, the radial artery puncture hemostasis evaluation. This is the protocol publication of our multi-center randomized controlled trial already running. We drafted a protocol of this study. We have actually 3 arms in which we examine the patients presenting for elective or acute coronary catheterization, diagnostics and interventions too. And we have a 3-arm randomization. One is the normally used mechanical compression device, and one is the potassium ferrate-based facilitated compression device, and the third is the chitosan-based biological facilitated compression device. We remove this device from the patients after the procedure in about 2 hours, and we make control ultrasound examinations right after the removal and approximately after 60 days. And we actually had the luck to publish this manuscript, and if the center informed me right, this was the first publication of the Semmelweis program of the Translational Medicine Center in the Frontiers Cardiovascular Medicine journal, which is a Q1 6 impact factor journal. The second project, which is ongoing, is the drug-coated balloon effectivity in the treatment of early and late drug-eluting stent in-stent restenosis. This is a systematic review and a meta-analysis, which is about which is right to do because the coronary heart disease approximately affects more than 100 million people worldwide, and is responsible more than 35% of deaths in Hungary. And though the allowed drug is protecting from in-stent restenosis, still presenting in 10% of the cases. And there is no current decision about the optimal treatment strategy of these lesions. Mainly 2 treatment options are available. One is the new layer of DES, and the other is the drug-coated balloon known as DCB. DCB could be the future direction, and it might be not as effective in early DES ISR, which is developing less than 12 months, than in late, which is developing more than 12 months after the index procedure. And we aim to decrease the need of recurrent revascularization. So we had a patient population of post-PCI patients receiving drug-coated balloon treatment for DES ISR, and we compared the early DES ISR with the late, and had a major cardiac adverse event composite endpoint containing target lesion, revascularization, cardiac death, myocardial infarction, and these separately. We performed a systematic search in the 5 big databases, and at the full text search we had 4 eligible records to do the analysis. After the data extraction, we had the major cardiac adverse event composite endpoint, which there was 2 studies included, and had up to an odds ratio of 1.68, which means that the patients with early DES ISR had 68% bigger chance to have this pathological state than the late DES ISR group. We had the other outcome analyzed, which was the target lesion revascularization, in which we had 3 studies, and we had an odds ratio of 1.69. And this strength of these analyses was that it made a clinical and statistically significance between the results of early and late DES ISR with treatment of drug-coated balloon. However, the separate studies couldn't do this. The limitation is that there are relatively low patient number and number of studies, unfortunately, but we can conclude that DES ISR appears earlier than 12 months after the index procedure. Then we should screen the patients more frequent for worse outcomes. And more randomized controlled trials are indicated on the subject of DES ISR treatment with drug-coated balloon, with recording the time frame between the index procedure and the, following the clinical event. So this is at the stage of accepted by supervisor, and we would like to send it out on the next week for internal review. And we also target the Journal of Frontiers. We would like to have luck again. My third project is the Open ISR optimal treatment for coronary in-stent restenosis, which is also a protocol publication for also running multi-center randomized controlled trial, which has basically the same implications like the meta-analysis. Just in this we compare also the drug-eluting stents, actually the most modern one, the third generation drug-eluting stent with sirolimus or paclitaxel-coated balloon in patients presenting with drug-coated balloon, drug-eluting stent in-stent restenosis for PCI. We have the outcomes of the trials usually have, which is target vessel myocardial infarction, target lesion revascularization, late lumen loss, and we also observe secondary outcomes with optical coherency tomography imaging. And our hypothesis is that the novel drug-coated balloons perform as good as the third generation drug-eluting stents. So we drafted a protocol with patients eligible from 18 to 85 years, no pregnant or lactating women, of course. And we will, and actually started to include 150 patients which are presenting for DES ISR, for PCI. We have the 3 arms, and the OCT subgroup is around 10-20% of the patients involved. And then we plan to analyze our results. I think in the next year the inclusion can be completed, so we are looking forward to that. Thank you for your attention, and I would like to close with Jean-Jacques Rousseau. People who know little are great talkers, while men who know much say little. Thank you.
What is your hypothesis about the first project, that which arm will present the most bleeding and which arm will present the most thrombosis rate?
Thank you for the important question. Regarding that, I just summarized it because it cannot be changed already, but we have so basically we have better experiences with the chitosan-based sponge rather than the mechanical compression device, and also a little bit better than the potassium ferrate disc. So actually, I think, so this is a non-inferiority trial, but we will, as I cannot include you in the details now, but we already have some, and I would say
just give 1 point only to him.
We may meet our criteria.
Yeah, thank you. Just because I think this is a very important trial to check the safety of these 3 arms, which one is the best option for the patient.
Yes, so in our way of thinking, the chitosan-based will be that, but I cannot say.
Don't tell me.
Yeah.
Okay, thank you.